Back to work is a key issue to allow people to come back to the normality when they have a chronic disease as cancer. But the problem is that at this moment, when a person with a chronic disease wants to come back to work, sometimes or usually they are dismissed because they have a reduced capacity of poor performance and loss of productivity, and so the employer dismissed them. The problem is that in the vast majority of countries, these dismissals are possible because the dismissal for reduced capacity or for absence from work is permitted. So I try to study how we can change the dismissal regulation to prevent the dismissal of people with chronic disease by changing the interpretation of these causes of the dismissal. And I have seen that anti-discrimination legislation it's key to protect people with chronic disease from dismissal. One possible solution could be consider chronic disease as cancer as disability. And this is what the Court of Justice of the European Union has done in the last years. But in my opinion, this is not the best solution because as we know, the number of people with chronic disease will increase in the next years. And in my opinion, we cannot consider all these people as disabled people. And we have also seen that the level of occupation of people with disability is not very high. So if we consider people with chronic disease as disabled, maybe they won't find a job. I propose to consider chronic disease as a specific cause of discrimination. So people can access to reasonable adjustments and protection against dismissal, but without being considered disabled. I propose to introduce a new category in the legislation about chronic disease and to introduce a new definition. It will be need to change the directive on equal treatment and employment opportunities, and it's quite difficult because it's an important reform in the European law and also in the national legislation of the states.